Hi, my name's Barbara Jenkins, and I'm going to be talking about problems that adults encounter as they age and begin to start taking more medication. I'm going to focus a lot on polypharmacy, which is defined as taking 5 or more medications simultaneously, which means you take about 5 a day. The average adult over 65 takes 6 a day, so this is a majority of the population. Some of the topics I'm going to discuss about medication use in adults is improper medication use, remembering to take medication, falls associated with medication, post-hospital home medication management, and drug-to-drug interactions. So first I'm going to talk about inappropriate medication use, which is just unnecessary medication use or wrong medication, meaning you're taking a medication that's not right for the condition, or also addiction, which is really hard to detect in older Americans because they do live alone and they're not going to a job every day, so people don't see them as often. Another big inappropriate medication use is using the wrong dosage of a medication. This happens a lot because studies and tests and labs only incorporate a limited amount of study patients that are over 65. Also, because of socioeconomical reasons, a lot of older adults try to stretch a month's prescription into a 2-week prescription into a month. So they're actually taking a half a dose, which normally doesn't do anything for their condition. Another reason is because as adults age, their bodies are changing, and they're not able to process the medications as well, especially the liver and the kidneys. They can't process medications, and the distribution of fat and tissue in the body as you grow older makes seniors more susceptible to side effects with a dosage of medication. The solution to this is really going to a doctor and talking to them about all your medications, making a list of the medications you're actually taking and the dosages actually being taken, so they can see which ones you're taking and make sure that they're the right ones for your condition, make sure there's no side effects, and bring those up if there are some. Another one to utilize is the pharmacist. If you are an older adult, it's best to go to use one pharmacist and get all your prescriptions fulfilled there, because then there's one person in the healthcare field that knows everything that you're taking and can see it right there on their screen. The pharmacist can also answer a lot of questions about the drugs, even more mostly than doctors can. They can know the purpose and names of drugs, where you can find the drug at a cheaper cost, how to take the drug, when to start and stop taking the drug, some things to avoid while taking medications, and some things to watch out for. So definitely pharmacists are best to utilize with inappropriate medication use. So a second medication problem with older adults is remembering to take medications or actually physically taking them. That's because as adults age, their vision goes, so it's harder to read those tiny medication bottles, or their hearing goes, so it's harder to hear the pharmacist or the doctor when they're telling them the instructions about it. Also, a lot of older adults have arthritis in their hands, and it makes it really difficult to open up the pill bottles. Also, swallowing the pills and tablets themselves, a lot of them are really, really big, and it's harder to do as you get older. Another one is just remembering to take them and the schedule to take them. So a lot of people remember in the morning, oh yeah, I totally forgot to take my medication last night, and what should I do?